All right. So now for the integumentary system, we're going to get into the very last bit, which is diseases, disorders, and injuries of the integumentary system, which we're going to mainly focus on like all the things that go wrong. We're not going to get super deep into treatments in the lecture videos, but you will see some of that stuff in your book. But what we're going to worry about here is we're going to talk about some of the different diseases and disorders of skin, and then talk about injury and the process of healing. So we can't talk about skin without talking about skin cancer, right? That's the big one. Skin cancer can be broken into different categories. So skin cancer is a very generic term, but let's get and talk about each of these. So we have basal cell carcinoma. Basal cell carcinoma. So we think about the name. Carcinoma tells us we're talking about an epithelial-based cancer. Basal cell. This is going to be a cancer that is happening in the stratum basale in the epidermis, right? The name tells us. We get to squamous cell carcinoma. Squamous, that just tells about the shape, right? This is not going to be in that basal though. This is going to be in the stratum spinosum, right? And these basal cell carcinoma, squamous cell carcinoma, again, these are both affecting the epidermis. And so these tend to happen in areas that are exposed to the sun more. So you think like on the face, on the backs of your hands, the ears, and the scalp, right? Those are some common areas. And really, if you think about it too, why those three? Why scalp, ears, and hands? Besides the fact that they're exposed, they're probably also the least likely places to get things like sunscreen put on them. How many of you put sunscreen on the backs of your hands or on your ears or on your hair, right in your scalp? Most people, like, they put it on their face, they put it on their shoulders, their arms. They don't really think about those areas. So squamous cell carcinoma tends to happen in these areas, one, because these areas tend to get exposed to light a lot, right? They tend to get exposed to UV light more often than other body parts. They're also some of the areas that we tend to skip out on when it comes to things like sunscreen. Basal cell and squamous cell carcinoma, these are both treatable, very, very treatable skin cancers. And then the last one we have is melanoma. Melanoma, this is where the melanocytes are going out of control specifically, which again is still kind of like epidermis. But of the three, melanoma is the one that's the most dangerous. Right, this is the one that you really need to make sure you catch early. If you suspect that you could have melanoma, you really need to go get it checked ASAP, because this one, if left uncared for, can and does become fatal in some people. And then they do come back for some people too. So someone who is diagnosed with melanoma, even at an early stage, is likely to have to get skin checks on a much more frequent basis than the average person, because they're much more likely to experience another problematic growth. So let's take a peek at what each of these look like. Here's our basal cell carcinoma. You can see it kind of looks red, pink, almost a little bit vascular there. You can kind of see little lines going through it. This would be squamous cell carcinoma. Almost looks like a scab, right? Like something, like a scabby appearance, the red and a scabby kind of look to it, like someone got scraped. The big thing though is it looks like a scab, but that scab never truly heals, right? You don't actually see a scab fall off in the new skin. It would kind of stay like this. And that's one of the big things is, like, if you have wounds that seem like they're never going away, that's a good thing to go get checked out, because it might not actually be like a cut or a wound. If it's something like on the skin like this, it could be something like a squamous cell carcinoma. The good news is a lot of people who have these, the treatment is to literally remove the tissue, right? Just cut the tissue out and a little bit around it, a little bit of a margin. Whereas a melanoma, these are going to look like a mole or freckles or things like that have kind of gone by the wayside, that don't look really normal anymore. So this would be a good example for melanoma. Now, we're going to be using a lot of pictures that are looking at Caucasian skin or someone with lighter skin with less pigment. It's important to note that skin cancers, including basal cell and squamous cell carcinoma, those can look different on people of color, right? And so for those who are going into healthcare, like especially nursing, who you may see people with skin cancers, it's important to note most of the pictures that you see in textbooks, in slides, and all that kind of stuff tend to be on white people. But it's important to note that skin cancers can look a little different on people of color. So just keep that in mind and keep that, an open mind when it comes to what these things look like. Just recognize that you have to be on the lookout for that there can be different presentations depending on the pigment of that person's skin. All right, but we're going to focus on these ones because these are the ones that these are the pictures I have access to. So this is a melanoma. We see, again, it looks like some sort of mole that's kind of gone a little bit haywire. When it comes to melanoma, again, it's super important that it is diagnosed as early as possible, because when it's diagnosed very early, the outlook is generally pretty decent. If it's diagnosed late, we see people die from it, right? And so it's really important that people are aware of melanoma and what melanoma can look like, and go get things checked out if things are changing. So a lot of times what we see this ABCDE device that's used to diagnose early stage melanoma. So ABCDE each stands for something that is different in like a mole. So we're looking at a mole, we're looking at some sort of patch of more pigmented skin on a person's body. Generally speaking, a healthy mole is going to be nice and round, right? It's going to be symmetrical. But if it becomes asymmetrical, the two sides do not mirror image each other, then that is something that's worth getting looked at by a doctor. The borders should be regular in shape. The edges should be regular in shape, meaning not fuzzy or anything, not have little tendrils or anything. If there are some distortions to the edges, that's something worth getting looked at. The color should be relatively even, so we should have like an even color, usually brown when it comes to a mole. But if it is changing shades of brown, black, it can even have shades of red or blue in them sometimes, that's worth getting checked out by a doctor. And then diameter. Moles can be kind of large, but they should be no larger than 6 millimeters, which is about the size of a pencil eraser, like on a typical yellow wooden pencil. If they're getting bigger than that, it is worth getting that checked out. And then the last one is evolving. If you've noticed things have changed, especially if they've changed rapidly, that definitely needs to get checked out. Some of the other things that have been added to this, and this especially for things that are, or if melanoma is getting more serious, would be the elevation. It's getting raised over the surface of the skin. It's starting to feel firm, right? So it's starting to feel harder to touch now. It went from like a squishy mole to what feels like almost like a rock. And then growing. It's getting bigger, right? Your moles, you will see some things on your skin change over time as you get older. However, if you notice a mole that was kind of small is now the size of a pencil eraser, it's worth getting checked out. Worst case scenario is they remove it and they tell you it's benign, right? If it's nothing. Or actually, worst case scenario is they remove it and they tell you, hey, yeah, this was a melanoma. But if it's not melanoma, the worst thing that happens is they remove it and it was nothing, right? All you did was just get a little thing cut off. Some other things that can go sideways with the skin is things like eczema. This is a reaction that kind of ends up being dry and itchy on your skin. So you'll have dry, itchy patches of skin. It almost looks like rashes. It's not contagious, but it does require some treatment. Sometimes you can use over-the-counter stuff to help soothe the skin. So you may see lotions and creams that are dermatologist approved for eczema. especially like colloidal oatmeal can be used for that soothing nature. And then another one is acne, right? This is usually on areas that have a lot of sebaceous glands, which means the face, the shoulders, the back. This can be from infection from acne-causing bacteria. There's a few different types that are out there. So there's like Proprione bacterium and Staphylococcus. These bacteria, like Staphylococcus, they are found on your skin naturally. It's just, are they in high numbers? And so, like I said, like people who may use too harsh of a face wash or wash their face too much may find that they break out in acne after doing so because they have given free rein to those bacteria to overgrow and cause that little tiny infection. Not all acne is caused by this, though. There are a lot of different reasons for acne, including hormonal reasons. So some people, their hormones are the reason why they develop this, and so treatments for acne can really vary, and it just depends on the individual case. It depends on what the dermatologist determines is the cause of the acne. So it could be using improper face care, so using too harsh of soaps, things like that. But it could also be just someone's hormones are responsible. Usually those show up as deeper cystic acne, and those that can actually be very painful and require treatment because it's not just an appearance thing, it's also a quality of life thing. But there's lots of different treatments for it, including antibiotics. There's different medications, then topical creams that can be given to help with it. There's also things like spironolactone that can be given as a medication. And in some severe cases, they'll actually use something like Accutane, which is a vitamin A derivative, which that is kind of like the big bomb that is used with acne because it does have side effects. It does have some concerns of its use, and so it's only used if it's absolutely necessary in most cases. Usually you try to go through a few other treatments beforehand. But like I said, there's a whole lot of reasons why someone may develop it. It could be because of bacteria, it could be hormones, it could be a reaction to a medication. Some birth controls, especially for women, can cause acne because of it causes changes in the hormones as well. So if this is something that affects you, it's important to talk to a dermatologist because simply just washing your face might not be the key to helping with acne. It could be a multitude of things that are causing it. So this is that eczema where you see that kind of scaly rash looking skin. Again, this would not be comfortable. It would be very dry and itchy feeling, and so a lot of things that people use are soothing to help calm that itchiness and that dry feeling. And then acne, again, this is just one example of what could go on with developing acne. We have like a plugged follicle where the hair is exiting out. This leads, because it's plugged, the sebum, the keratin, things like that, that normally would be excreted out onto the surface of the skin and down the hair shaft cannot be. And so they get stuck in the skin. Bacteria go, heck yeah, that sounds great. Because they now have basically a buffet. And so the bacteria proliferate. The sebaceous gland is still producing that oil the bacteria is totally fine with. So we get some mild inflammation, we get some mild irritation, and then as it grows, right, that's when you would get like the pimple, right, the red bump, right, where you actually see that inflammation. If you have one of these, as tempting as it is, you're not supposed to pop it, because all you're doing is introducing more dirt and bacteria into now what is now an open wound. So the big thing to do is just to use proper treatments that are on the face or given orally if given by a doctor to calm this down and break it down from the inside out. If you do pop something like a pimple, you run the risk of infection because of the dirt and bacteria you're introducing into an open wound, but you're also increasing your risk of things like scarring and hyperpigmentation as well, which nobody really ever wants. All right. Last thing is getting into burns. So, burns, this is a big one. People don't necessarily think of how serious a burn is. Now, burns can be caused by a lot of things. Intense heat, like fire, of course, but it can also be caused by radiation, electricity, or chemicals. But the big thing is that it's destroying the skin. And this is going to lead to massive loss of fluids, and it's going to be destroying the one major protective feature you have from bacteria and viruses. Now, we categorize burns based on like how deep is the burn going, how much tissue is damaged, right, in terms of the depth. The first degree burn is something that pretty much everyone in here has experienced at some point. If you've ever had like a little sunburn or you burned yourself while cooking, you probably have had a first degree burn. It's a really superficial burn. It's just on the epidermis. It hurts and it's red, but other than that, it's not too crazy. But then a second degree burn, we're getting deeper. Now we've gone past the entire epidermis down to the dermis. And so we can see things like blistering at this point. The third degree burn, now we've gone all the way through the epidermis and the dermis, which means we've destroyed tissues involved with nerves, we've destroyed tissues involved with sensory information. We're getting dangerous at third degree burns. And then fourth degree burn, I mean, we're going all the way down. We're getting all the way down to like muscle and bone, which means we're losing chunks of our body at this point with a fourth degree burn. We may, if it's like on a limb, we may even lose the limb at that point because we've lost so much tissue all the way from the surface down to the deepest components. Other things that can happen, scars. We talked about tissue healing and that you end up getting a less than perfect substitution after getting wounded, and that's scar tissue. So it's a lot of collagen that basically is wound around, but it's not as nice and neat as what was naturally there. It can contract to cause warping in what the surface of the skin can look like, and so this is what leads to a scar. We see a difference in coloration. Maybe we don't see hair growing there anymore. We may see a difference in texture, right, with a scar as well. Keloids, these are a specific type of scar. This is where it's raised or hypertrophic, so you have like an over creation of tissue. The one place where you may see this is when people get piercings like on their ears, especially if they got them done with like a piercing gun rather than a piercing needle. That can cause damage and cause a keloid to develop where it creates like a bump, right? You'll actually have like a little marble like bump where the piercing was done with a keloid scar. Those can be removed, however, it's no guarantee that it doesn't reform another keloid after removal. Bed sores can also develop. This is what happens when someone has constant pressure and a lack of blood supply in the same spot. So if someone is bedridden, they cannot get out of bed, they're laying on their back, there's a constant pressure at certain points on their back from laying down, and in those areas, blood flow may be slower or not be happening in those spots, and so it can actually lead to the skin to kind of ulcerate and then break down, and now we have an area where we can actually introduce bacteria and whatnot, introduce microbes to cause an infection, and the skin is going to actually start to break down to the point where we have these deep ulcers that need to be debrided, right, cleared out, and then patched up. So one of the things that they do to avoid these is to move people around, right? Change a person's position. So if someone is bedridden or has experienced some form of paralysis of something of the sort, then we will move that person, right? Flip them, put them on their side, put them on their other side, or we'll move them around so that they're never in the same position where we get those pressure points in contact with the bed or in contact with the chair all the time. Stretch marks can also occur. Most people probably have at least a couple stretch marks from growing pains from when you're a kid, when you're going fast. Anyone who has experienced pregnancy may have stretch marks, but this is just when the dermis is basically stretched beyond its limits of elasticity, and so you get these stretch marks. You'll have people doing all sorts of things with creams and all that kind of stuff to try to limit the stretch marks, but again, all it is just the dermis has been stretched beyond it. Um, it's not a serious condition, it's more of a superficial appearance thing for people after everything is said and done. While stretch marks are developing, though, with that, because you're stretching the skin, it can feel itchy if someone, let's say someone's very pregnant at that point, they may use things too to try to relieve the itching because that stretching does not necessarily always feel good. And then calluses, this is where the skin has been thickened because it's in constant contact or abrasion with something. So if you, let's say, walk outside barefoot a lot, you may develop thicker calluses or thicker skin on the bottom of your feet. If you have certain actions that you perform repetitively, you can develop calluses. So for example, I was a pole vaulter back in college, which means I was using a pole to launch myself over a really high bar, but that meant I did the same action with that pole vaulting pole over and over and over again. And so I had calluses on my hands, like right at the base of my fingers, right? I had calluses there because of that repetitive action over and over again. Calluses can also be caused by things like improper footwear, like improper fitting footwear on the feet, and that can be really painful for some people.